On this side.
Yes. Remind me of your name. I'm Ash. Ash. Ooh, what happened? Yes, good to see you. Daughter had to go do some stuff. Yeah, had a major stitches surgery. I saw. I was so happy to see that. Thank you, baby. Like, I think this is what I need. I'm so stressed out. So, like, here's antibiotic oil. Did you call it earlier?
Yeah.
And see us next week and we'll take the stitches out. So I'm like,
You're like, that's it? We'll chat about some good stuff. Yep. Yep. Oh.
Tell me?
No, no, no. Yeah.
Okay.
You liking the jams? Mm.
Okay.
Drums and tap dance.
There you go. Okay. Good, Dave? Okay. Okay. All right, guys, well, thank you so much for coming this evening. My name is Dr. Ace. I'm a naturopathic medical doctor at Regenerate Health Medical Center here in Santa Barbara on the Mesa. And I'm really excited to talk to you guys about skin. So, title is Psst. Your skin is telling you something. So we often think about our skin as things happen to our skin, external, but we don't really think of our skin as an integrated organ as part of our body. So I'm really going to be telling you what you really need to know about your skin and told before. So Dave, can you hit the next one? Yes. I have a clicker. Okay. So really, I like to give a lot of structure. So to let you know what we're going to be talking about, the main points, what your skin's telling you about your health. Why do you get acne? So we're definitely going to talk a lot about acne. So I know we have some people interested in that. Do you need to use sunscreen? What do we need to put on our skin? Does sun exposure cause cancer? And why does skin age and how can I reverse it? So I'm really excited to go on this journey with you guys. And at the end, you'll have some next steps for freedom from skin issues. So take it away. Okay, so why do we care about the skin, right? It's external. It's not a big deal when we have skin issues. Most of the time, they're not that disruptive. Sometimes they can be, but usually pretty minor. But really, there's so much misinformation leading people to use toxic things that really do have bigger consequences for our overall health. You know, and a ton of symptoms caused by some skin treatments can be digestive issues, weight gain, anxiety, depression, fatigue. You know, a lot of medications are pretty strong and are not always necessary. So we don't have to go through all of this just to make our skin look good. So once we understand why our skin has issues, we can go ahead and fix it. So first thing is, what is your skin telling you? So really, when you have acne, psoriasis, eczema, all these kind of common skin issues, our bodies need help. It's really not, first thing is there's something going on that needs to be addressed. It's not, oh, I have this, it's fine, I'm just gonna let it be. Your body's trying to tell you things with symptoms. So most medical treatments are gonna seek to suppress those symptoms. Cortisone creams, anti-itch creams, makeup, we're just taught to kind of cover it up so the issue goes away. But the issues often worsen after those treatments or tend to come back a little bit with a vengeance. So we kind of know intuitively that that's not treating the cause, but a lot of times people are at a loss for how else they can approach these issues. So there's really three main reasons why skin issues appear. So a decreased ability to detoxify, huge, and we're going to get more into that. Immune system dysfunction, also another huge category, and we're going to get more into that. And then infection. Infection almost speaks for itself a little bit, but there's also a lot behind why did this infection occur. You don't just get an infection on your skin for no reason. It still has to do with what's going on internally. Okay, so impaired detoxification. So as you guys may or may not know, your skin's your biggest organ. It's huge. It covers our whole body. And it is not designed to be a primary way that we detoxify. It's really designed as a secondary route of elimination. So if our primary routes of elimination are blocked up, your skin takes over some of that role. So a lot of times when we see eruptions on the skin, it's because those organs of detoxification, your bowels, so when you pass stools, sweat, when you sweat, and when you urinate, those are really the three primary ways that your body should be able to detoxify. But those can become blocked or impaired. This really happens when you have stress, increased toxins, and we're going to talk a decent bit more about that, because that's probably, if I'd say there's number one issue, increased toxic load would probably be it. Nutrient deficiencies, because those can therefore impair detoxification. Inflammation and other diseases of the bowels as well are really substantial when we're talking about blocking the routes of elimination. In terms of toxins, personal care products, foods, air, chemicals, dusts, molds, our bodies just really can't handle a lot of the toxins that we're exposed to, so those primary routes really need to be helped so we can take the burden off of the secondary organs like the skin. Okay, so the big four, sorry this is a little pixelated, the big four ingredients in terms of personal care products that are majorly problematic. Phthalates, so often found in fragrances. Even if things say fragrance, you can have phthalates in them. So unless it specifies essential oil fragrance, most products are going to have phthalates in them. So those have been linked to hormonal issues and reproductive health. And hormonal issues, another big component when we're talking about skin issues like acne, and we're going to get more to that. Formaldehyde, that's used as a preservative agent, is found in a lot of skin issues. It can become an irritant. Petrochemicals, a lot of preservatives there in personal care products. And parabens. Parabens are probably one of the most damaging because they're considered to be so safe. But there's actually research showing that the more parabens you have in your body, the higher likelihood of diseases like breast cancer. It's really a 1-to-1 ratio at this point in the research, so parabens are pretty gnarly. So just some fun statistics here to give you guys some perspectives about the toxicity side. The average US woman uses 12 personal care products daily, and they contain up to 168 different chemicals in 12 products, so it can be pretty staggering. Men tend to use fewer, so on average they're more exposed to about 85 chemicals. Teens on average use even more products, so more chemicals than men or women. Europe has banned 1,370 toxic chemicals from their personal care product, but we've only banned 11. So this is another thing, is even above and beyond skin, what we put on our skin. In this country, we have a very unique framework where things are considered safe until proven unsafe. As opposed to Europe, they have a little bit of a different way of doing that. So if you don't know 100% that what you're using is safe, it's probably not. Safe, organic, and natural, buzzwords for us conscious consumers, does not necessarily mean that the product is free of formaldehyde or parabens. It's still not safe, even though it sounds good. Really, your personal care products are likely can contain things like carcinogens, toxins, endocrine disruptors, allergens, and a lot of other hazardous things. And one last statistic, just as a ringer, that the President's Cancer Panel found that only 10% of cancers had a genetic link. Did you guys already read, or can you guess what the other 90% was? Environmentally induced. That means all of these things we're putting on our bodies that contain known carcinogens, well, they're contributing to cancers. Okay, so, yikes. Number one thing I'd say when you go home, if you haven't already, just pull out your favorite personal care products, scan the barcodes on the Environmental Working Group's app called Healthy Living. Healthy Living, it's by the Environmental Working Group, because I know you're writing that down, and just see what's contained in your products. Educate yourself, because sometimes the crazy scientific polypropylene, glyphosate, all these crazy words can be benign, but sometimes hard to know. So the environmental working group helps us out there. Okay, so getting to the second cause of skin issues, immune system. So our immune systems are really designed to protect us. But our immune systems can really get inappropriately triggered and manifest skin lesions. So, or the immune system can become focused on a different area of your body. Say, for example, you have a lot of digestive pathogens, microbes, parasites, yeast, bacteria in your digestive tract, and your immune system, as opposed to focusing on everywhere it's trying to protect, it ends up focusing primarily on your spleen, or it ends up focusing on your lymphatic vessels or your tonsils. And your skin, in the grand scheme of things, because our brains are primed for survival, isn't all that important when it comes to the immune system. So your body's going to allow you to manifest some skin issues when your immune system is pulled and prioritized for somewhere else in your body. So, common skin issues where this is the case, think of things like psoriasis, scaly, hard patches on your elbows, on your knees. Your immune system is hyperactive in a certain way, and it causes these things. Tinea versicolor, something that I have dealt with in the past. It's a yeast overgrowth on your skin. Everybody has yeast on their skin. It's very normal. But when you're chronically stressed or your immune system is focused on something else, it no longer prioritizes the skin. So that's a really common skin issue, especially when it's hot and warm out, and it'll manifest as white or red patches on your skin. So you might have seen people at the beach or sweating in the gym looking like that, and it's actually a really, really common one. The last thing is it can also be infectious, as I mentioned, as the third cause of skin issues, but usually there's some underlying susceptibility for why that infection took hold, unless you had your feet in, moldy boots for a week. Okay, that's exposure based, but most of the time, it's not going to be the case. So infection, a lot of them can manifest with skin issues. So a great one, as a matter of fact, I was just at a conference this past weekend talking about Lyme disease and mold. Super fun topics, I know.
Different topics, or are they linking them?
Linking them.
Okay.
Yeah. So Lyme disease, for example, which is a very problematic disease, primarily on the East Coast, but now spreading more and more to the West Coast, can manifest with a very characteristic skin rash. Now, if we were to only treat the skin, then you're missing out on the whole picture. So it's just a really good example of how the skin is a symptom. The skin in of itself is not usually the issue. Okay, so jumping to acne. So when we get acne, it tends to manifest on face, back, more sweaty areas. And really the number one reason is because our routes of elimination are overburdened. Kind of what we talked about at the beginning. And or we have increased toxins. And in that, I'm going to include the category of hormones, because how our bodies work in terms of our hormones, because hormonal acne is up in the top causes. Most women tend to be worse around their menstrual cycles, in which case you know that there's a strong hormonal component. But the hormones still go back to detoxification, because our body produces hormones, and then our liver, this wonderful organ right here, has to clear them in a way that we can then flush them out once we no longer need them. And a lot of times, once that clearance is sluggish, those hormones stay active longer, whether it's testosterone or estrogen or progesterone. Though usually testosterone is the offending one, and we get more breakouts, because those hormones now become sort of a burden to the body because they're not being properly cleared out. Now, acne can also be caused by increased oil production. That's what most estheticians are going to say. Most people that are focused on the skin, it's excess oil, we need to cleanse your skin, it's clogged pores with bacterial growth. So use cleansers, exfoliate, work on the skin, which is a partial truth. That is true, that is part of acne, but usually there are underlying hormonal reasons for why the body is producing that excess oil. Now, once we can support the body, open the routes of detoxification and balance out the hormones, voila, it's pretty miraculous. I've seen it in countless patients, the vast majority of whom tend to be teenagers or sort of 35-year-old women. The younger group, Hormones are really changing a lot. Nutrition's not that great. There's a lot going on in the teenage years for why acne is so common. But then for women, there's kind of a resurgence around those 30s years when hormones are changing again. Lots of stress is kicking in. Women are figuring out where they're at in life. So those are sort of the two main groups that I treat for acne. And it's really amazing once we get the body functioning, its routes of elimination, hormones, all that, the acne clears up. So that's a much preferred route as compared to some of the more toxic things like antibiotics or bleaching creams or, you know, abrasion type stuff, because those all are going to have issues down the line. Next. Okay. Jumping to sunscreen. Okay, it's summertime. I know that pretty much all of us have been told that sunscreen is the best, you know, invention since antibiotics. In terms of helping us protect ourselves from cancers, specifically skin cancers. So poll, who thinks sunscreen is good? Okay, who thinks sunscreen is bad? Okay, we're more in the bad camp. All right, it really depends. So there's a lot of things. So it really depends on how much time you spend in the sun. And it also depends on what's in your sunscreen. So we can't really make blanket statements. Sunshine is essential for life. And blocking it with sunscreens while you're outside just fuels our deficiency of natural sunlight. So I just did a blog post on this last month actually talking about the benefits of sunshine, natural light. It is essential for our bodies to get that full spectrum red and blue light for our bodies to make appropriate hormones, to have good sleep-wake cycles, to properly detoxify, properly absorb. Our bodies need that natural light. And one of the main things we need is we need to make vitamin D from it. And sunscreen at SPF 30, which is kind of a midline SPF, it blocks 95% of your vitamin D synthesis. So if your only time out in the sun, you're spending slathered with sunscreen, you can guarantee you're vitamin D deficient, which is gonna have ramifications for your carbohydrate digestion, your mood, your pain, all your other hormone production. So vitamin D is actually more of a hormone than a vitamin, so it's crucial. And when I said it depends because whether sunscreen is good or bad, because most sunscreens are going to contain endocrine disrupting chemicals, meaning chemicals, hormone, and the production of hormones in our bodies, and our hormonal production glands are endocrine glands, as well as toxins that actually contribute to cancer. So it's this kind of interesting catch-22 when I'm at the beach and I see people with those spray sunscreens or slathering things on. When I see, you know, Banana Boat or some very generic brands that I know contain toxins, they're putting a known toxin, known carcinogen on their skin to protect from the sun, which can be a carcinogen, but also has things that we need. So it's more simplistic point of view saying block the sun exposure. We really need it. So, you know, now hopefully you guys can think about that if you go ahead and use sunscreens. Next slide, because I'll get to it. Really, the main issues in sunscreens, did I put it on here? Yes, I'm going to jump a little bit. Parabens, oxybenzones, PABA, a lot of things that tend to be more preservatives, but also things that block the sun's rays from damaging you. So it's kind of hard to understand whether or not we need sunscreen if we don't understand whether or not we need sunshine. So that's where I went into a little bit of, does sun exposure cause cancer? Another big myth. And as a matter of fact, this myth permeates all levels from layperson to doctor to academic, because I can't tell you how many doctors have told me, oh, you're fair-skinned. You shouldn't be spending time in the sun. You're gonna get skin cancer. You know, and it's unfortunate because I need time in the sun. But again, it's all in the details. So it doesn't have to, in terms of sun exposure causing cancer, because the sun is essential for life and also damaging. You know, nature designs things in a balance, so we need to respect that. So some of the things that we can do to protect ourselves from the damaging side of the sun is we can have an antioxidant-rich diet. lots of fruits and vegetables. We can drink more healthy and mineral-rich water. We can avoid stressors, all kinds, foods, toxins, all that. And the less damage you will get from those UVA rays, which for the most part are the more damaging rays of sun. But like everything in nature, UVA also has some beneficial properties for it in terms of the production of nitric oxide, which is a blood vessel opener. So there's really nothing we can say, oh, UVAs are always bad. UVB, though, does tend to have a little bit of a better rep, so we tend to focus more on that. So really, our bodies are designed to protect us from the damage from the sun when we get what we need. If we don't get what we need in terms of a healthy diet and lots of antioxidants, then yes, that sun exposure, all of a sudden we don't have the resources to protect ourselves, and then things like skin cancer can ensue. Now, it always also depends on the amount of sun exposure you're getting at any one given time. So say, for example, somebody from northern Canada goes to Cancun. Great, I'm going to go there for a week vacation. I'm going to spend 8 hours in the sun. That's not going to be good because their body has not had time to build up the defenses necessary to protect them from those UVA rays. So that also is the case for, Irish or, ginger people, really, red hair, super fair skin. They need to build up their exposure over time so that they can then protect themselves. Because actually, pigmentation is your body protecting you from the sun. So think of, African American people. They developed in the area where a lot of sun exposure was common. So they needed a natural way to protect themselves. In Scotland, they don't get a lot of sun, so they designed to hyper-absorb the sun's rays. Neither one's good or bad, but we can't say, oh, everybody's fine in 5 hours of sunshine. Everybody needs to be treated a little bit differently, but it's not the sun that's the problem. So really, if you have long and infrequent stints in the sun without a healthy diet and lifestyle, recipe for disaster, in which case it may be better to use sunscreen. But you want to be using sunscreens that are toxic free. So for those of us that have 20, 30-minute stints in the sun at a time, fantastic. That's what we need to make our vitamin D per each day. No need to go ahead and slather on sunscreen. But if you're going to be spending more time in the sun, it may be helpful to use hats or wear long sleeves, or again, use your sunscreen that is not going to be toxic. But it's also, people tend to shy away from it because it doesn't slather as easily, or it's maybe going to give you a white tint to your skin. There aren't the same types of chemicals to make it a super easy spray cream or spray or cream. So there's really a lot that goes into it, but my real point is optimize your health by spending more time in the sun in small stints, and keep your diet and your lifestyle healthy so that the sunshine doesn't become a carcinogen for you. Okay, why does skin age and how to reverse it? So skin aging happens due to decreasing hormones. So particularly for us women, as we approach menopause, our bodies are going to age much more quickly. Dehydration, a huge one. Now, dehydration is not just what we drink. Although getting in water is the first step for hydration, we also have to think about, is it getting into our cells, or is it just staying outside of our cells in the body? So in my office, we have a really fun way of testing that. We can test your total body water versus the water that's inside of your cells and the water that's outside of your cells. Because you need to have the water to even be able to get it into your cells. But you can be drinking half your body weight in ounces and still be cellularly dehydrated, which is going to contribute to rapid aging. So factors that help you hydrate: increasing minerals in your water, making sure that your water has a charge to it. Those are some of the most important things. And then decreasing your inflammation and toxicity, because water flows where the concentration is highest. So if you have a lot of toxins in your body, it's not going to stay in your cells. It's going to flush out. So hydration is a bit of an art. And the last reason is going to be increased oxidative stress, aka DNA damaging stress. So when we're just talking about sun exposure, if you have that sun exposure and you don't have mechanisms to protect yourself on the inside in forms of antioxidants, that sun is now going to become an oxidative stress on your body, and especially your skin cells. So, but the key is with oxidative stress, it's more oxidative stress than your body can repair from. Because just like with building strong bones, we have to have stress through our bones to build the strong bones. Just like having a healthy body, we need certain stress, but then we need to be able to protect ourselves from that stress. Again, nature does things in balance. So the question is really, aging, you know, in our culture is a bad thing. It's also considered inevitable, and you have to protect yourself from it. But there's a lot of things that you can naturally do. You can keep your hormones healthy. So if you are in your 20s, 30s, 40s, having that healthy lifestyle, making sure you're detoxifying, not putting toxins on your skin, bowels, sweat, urine are all working really well, your body's systems are functioning, then your hormones are going to be healthier. Otherwise, you can use bioidentical hormones. Because there are a lot of women in my practice, tend to be 50s, 60s plus, where their skin just becomes more friable, more irritated, looser, thinner, more painful. And once we get them on bioidentical hormones, they feel a lot better. And their skin looks better, that has more plump to it, more vitality. And make sure your cells stay hydrated. Like I said, drinking water is only the first part of it. It needs to be quality water, and then we need to be able to absorb it. And with hydration also are fats. So I know as a society we went through a fat is bad phase. Thankfully, it seems like we've come out the other end. People are now eating eggs, eating butter, realizing that fats are really good. Fats are really important for those cell membranes. Cell membranes are what keep essentially our body and our skin together. So making sure you have plenty of fatty acids in your diet also keeps your skin hydrated. Back.
Juicing.
Yeah, absolutely, because of nutrients. So the juicing, if you're juicing green leafy vegetables in particular, it's going to be a really bioavailable way to get a high dose of nutrients. What are nutrients? Vitamins and minerals. They make our body's chemistry function better. So when you're juicing or when you're getting a high amount of nutrients, your body's able to detoxify better. Your body has higher amounts of antioxidants. So your body can do what it does best, protect you and get rid of toxins. So really decreasing toxins is the last thing to sort of stave off or reverse aging, and boosting your glutathione. So glutathione is the #1 antioxidant that we can make, but that under times of stress, toxicity, dysfunction, our body uses it to protect us from those toxins, and so our cells take a hit. So in a lot of chronic diseases or for anti-aging purposes, glutathione is the #1 thing that when we supplement with, it helps a lot.
The other thing is that glutathione, the ability for the body to produce it, decreases.
It does. Your ability to decrease it and make it, because most people's absorption of nutrients decreases over time, and glutathione is made from some amino acids, which we, as long as you're eating proteins, we should all theoretically be getting in. But as we age, our stomach acid decreases, so our ability to absorb goes down over time. So aging is not necessarily very fun, but it doesn't have to be a problem if we know what's happening and we can stay ahead of it and protect ourselves. So another thing you can do is use your body's own ability to regenerate itself to actually do that. So we can actually do facial applications using platelet-rich plasma, aka liquid gold, which is spun down from your own blood. So your cells can be applied in a way to your face that can boost your collagen, decrease fine lines, and it's pretty amazing. So it really is an amazing anti-aging procedure that is free of toxins and chemicals. You know, I can't tell you how many estheticians will advocate chemical peels or Botox or things like that, that yes, do they make wrinkles go away? Do they make you look younger? Sure, but they're definitely adding to your body's toxic burden. And our body's amazing. We can use this platelet-rich plasma for a lot of ways to help rebuild our bodies, our face, our joints. It's pretty amazing. And the other thing is really giving your body the nutrients that it needs to rebuild collagen. So elasticity in our skin is also something that tends to decrease over time. The #1 nutrient for building collagen is vitamin C. So vitamin C, along with B vitamins, are the most important vitamins to supplement with as we're aging, because those get depleted in times of emotional and physical stress. So particularly in our community, with all the stress that we had in December and January, had a lot of patients that needed a lot more vitamins, particularly C's and B's, because their body was depleted. Because again, the brain's telling you to do what is consistent with your survival. So it's going to use those vitamins for things that keep you alive, not that protect you and keep you healthy.
So there's also different ways to get vitamin C.
There are different ways to get vitamin C.
You can take it internally.
Yep.
But what I'm finding is that putting it on my skin liposomal.
Yeah. Yeah, there's quite a few different ways to dose anything, as a matter of fact. Oral is the one we're most familiar with because it tends to be the easiest, but we also have the worst absorption that way because, although I love our liver very much, when we're taking things orally, a significant portion gets cleared out via your liver and you can't even use it. And that applies to pretty much all things, medications, supplements. So yeah, sometimes applying things on your skin, sometimes injecting them into your muscle, sometimes going into your bloodstream intravenously, directly, sometimes sublingual, so it can actually absorb into the blood vessels, into your mouth, so it bypasses digestion. There are lots of ways that we can do this. Okay, so right now, hopefully you guys have taken away some good points, and you're probably in one of three places. One being, hey, you learned a lot of great things tonight and you got what you needed. If you guys have more questions about acne specifically, we can talk about that too. So that's number one. The second place you might be is you like this sort of approach of looking at the underlying causes and treating things naturally, but you might have a few more questions about, hey, how does this apply to me? What should I be doing? What would that process look like? Anybody in that second case? Awesome. 1, 2. Yeah, well, if you are in that case in terms of having other questions, what we can go ahead and do is get you started in what's called our empowerment program, which is essentially designed to give people information about what some good next steps would be for them. So Dave can schedule you just a complimentary call with me, and I can answer other questions specifically for you. And the third would be that you know you have some skin issues and you're ready to address those right now. So if that's the case, we can also get you taken care of this evening. So with that being said, any questions I can address? Lizzo.
Can you touch on, someone had mentioned in the comments on our live video, just about certain times of the day going into the sun, and they're suggesting that the sunrise and sunset hours of sun are the best to be getting, and I'm just wondering if you have any insight into that for when you are sunning and how it affects you.
When you are sunning, what is the best time? And it really depends on what you're trying to achieve with being in that sun. If you're trying to harmful sun rays, morning and evening are going to be the best time. If you're getting out into the sun because you want to get a good dose of vitamin D, morning and evening are going to be the worst times because you really need that sun to be at its peak for your body to actually synthesize vitamin D efficiently. So, morning and evening time, if you're out in the sun a lot, those would be some better times. So if you're going to be out in the sun more than a half hour, max 45 minutes, around, depending on the time of year, 11:30 to 1:30, you're going to need to protect yourself if you're out much longer than that. Versus morning and evening, you could spend 2-3 hours out and not need to put on any sunscreen because the sun rays are so much less intense. So thank you for that question on social media.
Then also, too, if you wanted to sun without sunscreen in the middle of the day to get a lot of vitamin D, would that be like a 20-30 minute window situation where you aren't necessarily using sunscreen just to absorb vitamin D?
Say that again?
Like, if you want to get vitamin D, you want to download vitamin D, you want to do it between like 11 and 1:30 for the most optimal, right?
Yes, because,
20 to 30 minutes.
20 to 30 minutes, and it really depends again on your skin type, how much sun exposure you've had. So if you are a very fair-skinned person, you're probably going to have to start with 5 to 10 minutes. And what that's going to do is your melanocytes, so the pigment cells in our skin, are going to start to get a little bit darker. And what that is it's a protection mechanism. So even people that are very fair-skinned can tan, so long as they do it in very gradual exposures. Your more olive skin Mediterranean people, they can probably start out with 20 minutes as soon as springtime comes around, no issues, build up to maybe 45. Myself, I'm a little bit more you know, on a scale of ginger to African American, I am probably, you know, on the ginger side. My family heritage is from Scotland and Swiss Germany, so I need to be careful. But I'm in California and I love the sun and I love swimming, so I just make sure that I gradually increase my sun exposure to the point where now, you know, we're a couple months into summer, I can be out for a good 45 minutes to an hour without being concerned that I'm damaging myself. But at the beginning, I would not have done that because I don't want to increase my risk. I hope that answers the question.
I sun every day that I can at high noon, and I do, for me, my skin, 8 minutes on each side.
Okay, so you do 8 minutes on each side?
Even 10 minutes on
Yeah.
each side.
And what skin type do you have?
Well, I'm freckles.
Exactly. So you are going to be in that category of the most sensitive. So there you go. 19 minutes.
My skin absolutely is tan now.
Yeah, I can see that you're tan. So yeah, I mean, it's that gradual exposure over time that you can get the benefit from the sun. So my brother, for example, is a redhead, so he's a sun phobe, and I try to let him know the sun is really good for you. You need the sun. If you're indoors all the time with all this synthetic light, that's going to mess with your hormones and a lot of other things. So it's really that natural gradual exposure that we need.
There's an app called D-Minder.
D-Minder.
D-Minder. And I'm not all that familiar with all of these apps and things, but that one is one that I use because it will give you, for where you are and the time that you look at it, it will give you the amount of UV rays that you're going to get.
So D-Minder will give you the amount of UV rays that you'll get at any time of the day?
Yes.
Awesome. So on social media, if you download an app, D-Minder, you can figure out exactly how much time you need to be out in the sun for that time of day. Awesome. Thank you. Did you have a question?
Yeah, so continuing on this, so we're outside, you know, 1:30, taking a walk. How much, like, skin do I have to have even exposed? Like,
to get your optimal vitamin D, really the more skin you have exposed, the better. And the less skin you have, the more time it's going to take. So, you know, for us ladies, wearing a sports bra and shorts or something. You know, gentlemen, taking your shirt off or something. Yeah. You know, it really is, you're only going to absorb it on your naked skin. So it is important to give your sun that exposure.
Well, in some areas of the body, get a lot more sun.
This is true. Some do.
In the arms.
Yep.
That's why most skin cancers develop on the forearms.
Yep.
So you want to get the sun on other parts of the body just to balance it out.
That's true. Yeah, you want to balance out that sun exposure.
Like wear
Yeah.
shorts or something.
I was just wondering, in case you are going to be in the sun for a longer period of time, do you have any brands of sunscreen that you would recommend?
Do I have any brands of sunscreen that I would recommend? You know, I'm going to be honest. I think the last time I used sunscreen was probably maybe last year, if not the year before. But Lizzo.
I want to recommend that there are natural forms of sunscreen. Like, I'm not going to say put coconut oil on and go in the blistering sun for hours and it's going to protect you.
Yeah.
But it is a slight protection, and then there are natural sunscreens with like 5 ingredients in them that are awesome.
Yeah.
And then also, if you're familiar with Living Libations, they have this serum called the Sun Worshipper Serum. All natural, super harsh, like there's no harsh chemicals in it. It's beautiful.
Yeah.
And it actually helps your skin harmonize with the sun's rays, so you get
Beautiful.
better.
I would say, I mean,
That one's Sun Worshipper.
Sun Worshipper Serum. Okay.
And Living Libations. You should,
Yeah.
that brand, I feel like it would be
Nice.
cool to have you check out.
Yeah, I'd love to.
So isn't the working ingredient, I think it's zinc oxide, is that right? Which is that white kind of, that babies use it for diaper rash, but that, if you put that on your skin, it will
That can block,
absolutely
yeah.
protect it, and it's totally safe. for use.
Yeah, so I mean, for the most brand focused, I tend to look at the ingredients or scan the labels and just see. Again, the environmental working group is going to have a lot of these products in their repertoire, so you can see if what you're using is safe. Yeah, Lizzo.
The app that you were mentioning, D-Minder, can you spell that? Someone's asking online what it is.
Yeah. While we're waiting, any other questions?
I have a,
Yeah.
I have a question about the points you made on dehydration.
Yeah, dehydration.
Is that like dehydration over your lifetime, like you're aging because you're continually not absorbing hydration in the way that you should be?
It's definitely going to be cumulative.
Okay.
Yeah, for sure. So I mean, if you think about it, look at a baby's skin.
Yeah.
You know, it's plump, it's soft. There's very little wrinkles or anything versus, you know, someone in their third, fourth quarter of life. You know, it's going to be very different. Now, you're going to see the biggest differences in people's lifestyles when they're in their 60s, 70s, and 80s, because there are people that in that time doing things naturally can still maintain a decently healthy looking skin. Now, it's not going to look quite like a baby, but it doesn't have to look frail and dehydrated and thin. But you're going to see some people that definitely look that way. So it's not necessarily aging in and of itself, but what you've done over the course of your lifetime. So, you know, I'd say the younger you start to pay attention to your skin health from the inside out, the less you're going to have that frail skin as you age. I hope that answers your question.
Yeah.
Okay.
And I have one more follow-up question on that. I feel like you talked a lot about like external toxin or from like creams and whatnot, but I'm thinking like things like alcohol or cigarettes. Would that have the same impacts
Absolutely.
on the aging of your skin?
Yes. So toxins is an incredibly broad term. A lot of our foods are toxic. Cigarettes, 150%. I mean, those are incredibly toxic. So if I ever get a patient in my practice that is a smoker, I literally have the conversation of, okay, well, the first thing I'm going to need you to do is commit to quitting, and I'm more than happy to work with you on that, because that's going to impair every other aspect of your health. And alcohol. Alcohol is an interesting one. I personally have chosen not to have alcohol in my life because I've had enough health issues that I don't want to purposefully do something that I know is not good for me. But it's also very socially acceptable, you know. So, and I have, you know, particularly when I was mentioning the 30s something men and women, the vast majority still tend to enjoy alcohol with their friends, things like that. And those are the times when we start to see a lot of issues set in. So I have that conversation frequently of alcohol is not going to be good for you. The more toxins you have in your system, the less your body can handle those dietary sources of toxins without manifesting symptoms like acne or skin rashes or flushing or fatigue or you know, blood sugar issues. There are a lot of things that can stem from that. So yeah, absolutely, what we eat is a major source of toxins. What we're exposed to in the air, whether it's cigarette smoke or, you know, from us or from other people, air fresheners, perfumes, and then of course the personal care products are huge. So toxins are a very, very big problem nowadays.
Do you mind talking a little bit more about what oily skin means for you?
What does oily skin mean? Sure. I mean, it really, well, first and foremost, oils are actually good for us when we apply them to our skin. So a lot of people will tend to do a lot of things to you know, not apply any creams or anything like that. Avoid fats because they don't want to, you know, excessively produce that on their face. But it couldn't be more opposite. If you starve your body of those fats topically or internally, your body's going to produce more of that topically. Now, in terms of the hormones that make people have oilier skin, it tends to be people that metabolize their testosterone into their stronger form of testosterone called dihydrotestosterone. It tends to cause a lot of issues for men in their prostate health. It can cause issues for men and women in terms of oilier skin, because when we have more oily skin and we're not actually cleansing and then reapplying oils, then we start to get the typical acne progression of oil, dead skin, that becomes a closed environment, it festers and bacteria can thrive. So it's absolutely important to be cleansing your body and applying natural healthy oils to it so that you don't become excessively dry or excessively oily. Does that answer your question?
Yes, it does.
Awesome. Great. Well, thank you guys so much for coming this evening on this fiesta night. I hope you guys got some great info, and chat with Dave if you want to take part in the empowerment program, because that is our goal, to empower you guys with information to lead healthier and better lives. Thank you.
Thank you.
Thank you.
Thank you.